Okay, so here we are in post-conference, and Alex, I know you were in the OR all day with your patient. How was that?
It was amazing. It was unbelievable. I can't wait to tell you about it.
Oh, I'm so excited. Well, I'm glad you could join us at the end of the day. And what a great experience as a student to be able to observe in the OR. I never got to do that as a student. Yeah, great. So before we sort of get started with post-conference, Karen, I want to touch base with you about Mr. Perry, right? So, let's kind of briefly discuss what really happened today.
Oh my gosh, you guys, the most unbelievable thing happened. So I had this patient, Mr. Perry, and I noticed he was short of breath. But I counted his respiratory rate and it was 28. And I noticed that he was kind of using like muscles in his neck, like accessory muscles we learned. And when I checked his pulse ox, it was still 96% and he wasn't wearing any oxygen. And so I immediately told the floor nurse, because I was really worried about him because he looked like he was uncomfortable. And the floor nurse just said he was fine because his pulse ox was 96%.
Okay.
And so that's when I went and got Professor Rachel, and she told me about how, I didn't know this, but people who have darkly pigmented skin can sometimes, the pulse ox can actually be overestimated. And so our policy, we checked it, it doesn't even mention that. And our policy hasn't even been updated since 2018.
Wow. And it's 2025. Right? Yeah. And so excellent. I mean, this was, not that we wanted this situation to happen, but this is an excellent learning opportunity, which really leads me to sort of my first question for post-conference. And as we're, talking about domain 4 today, right? So how do you think a policy change can lead to more equitable care for our patients?
Well, I think that if the policy was updated on the limitations of the pulse ox, then I think that the nurses could do a better job assessing the patient and looking at the patient's symptoms and what the patient is feeling, instead of just looking at a number that may look okay.
Right.
But in the meantime,
And
Excellent.
it would prevent patients with darker skin from having their symptoms dismissed because of like an inaccurate reading.
right.
It's like the policy gap creates unequal care, even if no one's trying to.
Right.
Yeah, exactly. Excellent point. So when we think about these outdated policies, like we've discovered today, right, that's really what perpetuates these system inequities. Happy that this was picked up on. Oftentimes this is really all the time, it's unintentional, right? We just don't realize it. We don't know that this is happening. So when we update our current policies based on, current evidence, that really helps us standardize equitable care for all patients. So my next question to you today is, how will you respond the next time you ask a question about clinical practice and a nurse says, well, we've just always done it this way? And I've been guilty of saying that too, right? But how would you respond to that?
Well, I think we can just always ask, like, if there is a policy in place, right, that supports this practice.
Yep.
So.
And then we could look up the policy
Right.
and see if there's anything newer in the
Right.
research.
Right.
Yeah.
Yeah, but what if the nurse gets annoyed with us, like we're questioning them?
Yeah, and that's hard, especially as a student. It's even hard as an experienced nurse, right? I think it's part of the professionalism in nursing practice, right? And it's really all about the way that you say it and all about the way that you ask it, sort of coming across as we're framing this as a learning opportunity and not criticism, because that's the truth, right? We're all trying to learn. And we really don't ever want to stop asking those big, important questions. And if, your concern is ever dismissed, and you feel like this really needs to be addressed, that's when you escalate it to someone like me or a clinical instructor, the nurse manager on the unit, or to a provider, because that's what patient advocacy is.
Yeah.
Yeah.
Yeah. I didn't even know that students can influence the policy and the policy change. That's so cool.
Yes, you all play such an important roles, right? I mean, I'm excited to hear in the OR today about aseptic technique and, you know, how important that must have been and so different for you to see from working on like a medical unit, right? Yeah, but when we hear those terms, like we've just always done it this way, or, you know, it's been however many years since the policy was updated, that should sort of be a red flag that, you know, we need to go and investigate this. And that's all of our responsibilities as nurses. We have a professional obligation to advocate for our patients. So, you know, next week, I want you to sort of think over this week, and next week we will talk about in pre-conference, I want you to identify one practice that you've observed or made you wonder, why do we do it that way? And then we will discuss that next week using evidence. So when we think about critical thinking, you know, and that advocacy, that's how we can really provide more equitable care for our patients. All right, so let's hear about the OR now. We are all so excited to hear.